Good evening and welcome. I'm James Liu and I'm a librarian at the Stanford Health Library. Thank you for joining us tonight for our talk, which is Better Sleep, Less Pain, What We Know and What You Can Do. It's my pleasure to introduce our two speakers, Dr. Samsuk Kim and Dr. Heather King. Dr. Kim completed her doctoral training in clinical psychology at the University of Detroit Mercy, and her predoctoral internship at the VA Boston Healthcare System. Dr. Kim is currently a postdoctoral fellow at Stanford Pain Medicine, where she divides her time between clinical care and research. Her research focuses on uncovering the bidirectional relationship between sleep and pain, aiming to develop personalized intervention that improves sleep and pain. Dr. King is a clinical associate professor in the Department of Anesthesiology and Perioperative Pain Medicine, and she also serves as the director of the Pain Psychology Fellowship. Dr. King's area of expertise are in evidence-based therapies, including cognitive behavioral therapy for pain and insomnia, biofeedback, and acceptance and commitment therapy. She also developed integrated protocols for co-occurring chronic pain and insomnia. Dr. King presents at national and international conferences to facilitate knowledge of effective behavioral treatment options for chronic pain. Her research focus includes serving as a master CPT trainer for several NIH grants and is the director of online CPT services for the study called PCORI Progress Study. Throughout this talk, please go ahead and enter any questions you have in the Q&A box at the bottom of your screen. Again, it's the Q&A box, not the chat box. So do it with the Q&A box at the bottom. And at the end of the talk, Dr. Kim and Dr. King will answer as many of those as possible. Over to you, Dr. Kim and Dr. King.
All right. Thank you so much for this invitation. And thank you, everyone, tuning in this evening. We are really thrilled to share what we know about sleep and pain and also strategy. Just go over. This is what we are going to cover today. So first, I am going to cover about what we learned from research about the connection between sleep and pain and how one affects the other and why this relationship matters so much for your pain and overall well-being and how sleep happens as well as how pain can impact sleep system. So, and then once I finish that, Dr. Kim will talk about what you can do to improve sleep and reduce pain. And she will walk us through some practical strategy that have helped many people to improve sleep and manage pain better. So after that, we will open up, as James mentioned, we will open up the conversation for discussion and Q&A, and we will also share some Dr. King, I think you're moving my slides. Sorry, Dr. King. So we will also share some helpful resources that you can take with you. All right. So I want to start out by saying that your sleep is essential for your survival. So in fact, we all spend about 1/3 of our lives sleeping. Right? So sleep plays an important role in keeping us healthy, and it helps keep the immune system strong, support heart and metabolic health, regulate mood and emotion, and improve memory and focus. More importantly, it helps the body manage pain and recover. But when sleep is inadequate or disrupted over time, it can actually have a serious effect on your physical health and mental health. And pain is also essential for our survival. And pain is a survival mechanism that alerts us to danger and get our attention fast. So this is why we might instantly pull back our hands from something hot or sharp. It is our body's way of saying it's danger, watch out, right? And additionally, this hum or alarm help us protect ourselves, slow down, and give our bodies a chance to rest and heal. In fact, pain can even make us feel more tired, and this is our body encouraging sleep and recover. So while pain signal us to rest, it also activates the brain and body. That arousal or the activation can actually make it harder to fall asleep and stay asleep. Indeed, a significant number of people with chronic pain, between 67 to 88%, complain about sleep problems. And 44% of chronic pain patients actually meet the diagnostic criteria for sleep disorder of some type. The most common sleep disorder in chronic pain population includes insomnia, number one, and sleep apnea, number two. What's interesting is that more than 50% of people with actual insomnia have also chronic pain. And the chronic pain, chronic sleep problem can negatively impact multiple areas of life, including physical health, daily functioning, such as weakened immune system, low physical activity, emotional and mental well-being, such as depression and anxiety, and even broadly life and financial aspects, such as loss of productivity and increased healthcare cost. So now let's take a closer look at how sleep and pain influence each other. So when we don't get enough sleep or have a fragmented sleep, our body becomes more sensitive to pain. And one important function of our brain is to help regulate pain through a process called top-down inhibition. Basically, it helps the brain to turn down the volume on pain signal. So when we have a poor night of sleep, this pain regulation system is less effective. So this is one way why pain feels worse when we have a poor night of sleep. And not getting enough deep sleep slow down healing, and poor sleep can increase inflammation in our body, which can make pain worse and harder to manage pain. And sleep helps regulate important brain chemicals like serotonin or epinephrine, which are known to play important roles in managing mood, stress, and pain. When poor sleep happens, this balance gets off, which can worsen our mood, heighten stress responses, and increase pain sensitivity. And poor sleep can make it harder to think clearly and manage emotion effectively. It can also increase worry and make you even more focused on your pain, which actually lead to greater pain sensitivity. On the flip side of things, pain can make it harder to fall asleep, stay asleep, and rest deeply. And pain can make our body in a state of alertness, making it harder to relax, even when we are exhausted. And pain often leads to lighter, more frequent awakening and decreased deep sleep, which means our body don't get deep rest it needs. So when we are in pain, especially at night, our mind tends to focus more on pain sensation and more worried about what maybe tomorrow it looks like and what to do tomorrow and things like that. So such attention and worry about pain or even worry about other things actually can keep us in a state of alertness, making it really difficult to relax and sleep. Indeed, research suggests that people who worry more about pain often experience a higher pain level and poorer sleep. So while this bidirectional relationship between sleep and pain clearly exists, current research suggests that this poor sleep may have even a stronger effect on pain than pain has on sleep. And this means improving sleep can actually reduce pain and as well as improve how you feel and support overall health. So to understand the bidirectional relationship between sleep and pain, it might be helpful to understand how our nervous system links this sleep and pain together. So one important part of our nervous system is called autonomic nervous system, which kind of sends and receives signals from brain and spinal cord and connect with the body, communicate with the body. So what it does is it controls things that we don't even think about, such as heart rate, breathing, digestion, blood pressure. And this system has two subsystems. Sympathetic nervous system, which is like our body's fight or flight alarm. For example, as you can see in this slide, you are being chased by a bear while you're riding a mountain biking. And then the other system is a parasympathetic nervous system, which helps our body rest and repair. So you can think of them as sympathetic. S stands for stress response, and the parasympathetic P stands for peace response. So these two systems actually work together to help us respond to stress when it's needed and return to calm and relaxed state after stressor is done. So you might be wondering why this is all matter. Right? So when we are sleeping well, this parasympathetic nervous system, the peace response system, takes over, allowing your body and brain to calm down so they can do repair tissues, flush out waste from the brain, and process pain signals more effectively. But when sleep is disrupted, especially night after night, the sympathetic nervous system can stay turned on, keeping the body in a stress state, alert state. So what we know now from research is that when this stress state is activated, it can actually increase pain sensitivity. For example, one study had people who were woken up multiple times during the night. Actually, they reported greater sensitivity to pain than compared to those who weren't woken up multiple times. And similarly, several studies suggest that even one night of sleep deprivation make us even more sensitive to pain. This is because when we are sleep deprived or sleep disturbed, our brain struggles to turn down the volume on pain signals. In other words, our body's natural pain control system don't work as effectively as it should. So research suggests that when we are significantly sleep deprived, even a strong pain medication might not feel as effective. So sleep problem is suggested to be a strong risk factor for developing chronic pain from a short-term pain and maintaining chronic pain for longer term. So the good news is that improving your sleep helps calm your nervous system, and taking care of your sleep is one of the most powerful ways to support your body and manage pain more effectively. And then the reverse is also true, right? Managing pain can actually calm your nervous system, so making it easier to sleep. So sleep and pain are deeply connected and influence one another. So when we improve one, we can improve the other one. So now let's talk a little bit about the facts about sleep. So while we are sleeping, our brain doesn't turn off. Instead, it changes into a different mode of activity that supports restoration, healing, and memory processing, and many other functioning. In fact, by studying brain activity during sleep, we know that we actually go through different sleep stages while we sleep. So just broadly speaking, sleep is divided into two types of sleep stages, the REM sleep and the non-REM sleep. So REM stands for rapid eye movement. If you ever watch a baby or partner or friend sleeping and seeing their eyeballs are moving quickly under their eyelids, that's REM. And this is when most dreaming happens. And the other type is a non-REM sleep, which is a non-dreaming state, which has three actually sub stages ranging from light to a little bit less light and then deep sleep. So if you look at this image here, when we first fall asleep, we start out with a light stage sleep and then moving into a little bit deeper and then deep sleep and then back up to REM sleep, which is a dreaming state. And this is one cycle. One cycle takes about 90 minutes or so. And depending on how many hours you sleep, we typically go through about 4 to 5 cycles per night. And the first half of the night, we spend more time in sleep, deep sleep. And then the other second half, we tend to spend more time in REM sleep, the dreaming stage. And the one important thing to know here is that it is completely normal to wake up briefly during the night. On average, people wake up even like 6 to 12 times. And these awakening usually are very short and we don't even remember them. But for people who live with chronic pain, those brief awakening can become longer and more disruptive. And pain can wake them up and make it harder to fall back asleep. So as a result, people with pain often spends less time in deep sleep and more time in lighter stage of sleep. So if you frequently find yourself awake in the middle of the night and struggle to fall back asleep, don't worry, there are helpful strategies that can help you. And Dr. King will share some of those strategies a little bit later. And another fact about sleep is that as we get older, it's normal for sleep to change. You might notice that your sleep feels lighter, may be more broken up, or even you wake up earlier than you used to, or it may take even longer to fall asleep. And we also tend to spend less time in deep and REM sleep as we get older, which can make sleep feel less refreshing. These changes are actually normal part of aging. And in addition to these normal changes of sleep, sleep problem becomes more common with age. And two of the most common sleep disorders are insomnia and sleep apnea. Insomnia is like trouble of falling or staying asleep, which affects more than 50% of older adults. It's linked to worse physical health, more emotional distress, and greater pain. There is a good news. The good news is that there are effective treatments for insomnia. The most recommended treatments is cognitive behavioral therapy for insomnia. And research actually, the research was done in population with co-occurring chronic pain and insomnia, demonstrated that CBT for insomnia not only helps them sleep better, but also decrease pain. And Dr. King will share some of those helpful strategies later. So another sleep disorder that is very common in older population is sleep apnea. This condition is affecting up to like 30 to 50% of older population. And sleep apnea, the signs of sleep apnea includes loud snoring, gasping air during sleep, and feeling tired during the day extremely, even after a full night of sleep. If any of these sound familiar to you, it is important to talk to your sleep doctor. It can lead to serious health issues such as hypertension, cardiac disease, diabetes, even increased mortality risk if it's not treated. So again, why does this matter? Because chronic pain also becomes more common as we get older. More than 50% of adults live with chronic ongoing pain. And research suggests that over 50% of people with insomnia and sleep apnea also experience chronic pain, and they often report more intense pain and more widespread pain. So the takeaway is that improving your sleep is one of the most powerful things you can do to support your health and manage pain more effectively. So now let's talk briefly about how sleep happens. So it turns out what I learned is our sleep and wakefulness aren't random. They are carefully regulated by both our brain and the body. So there are two main processes that actually help your body to fall asleep and stay asleep. The first process is a circadian rhythm. So circadian rhythm is like your internal body clock that runs on an about 24-hour cycle. It helps regulate when we feel alert and when we feel sleepy. And this light plays a major role in keeping this clock in sync. So how does, and then probably you might be wondering, how does this relate to pain? Actually, the research suggests that greater irregular sleep schedule is actually a predictor for greater pain. And Dr. King will talk a little bit more in details what this system actually works. And then another process is sleep drive. This is your body's natural pressure to sleep. The longer you're awake, the stronger your sleep pressure becomes. So these two systems, your circadian rhythm, your internal body clock, and then sleep drive, so your circadian rhythm and your sleep drive work together to regulate your sleep and wakefulness cycle. And when they work together really well in sync, the sleep tends to feel more natural and refreshing. Then I want to bring attention to others. There's a third key system that actually affects sleep, the arousal system. This system controls how alert your brain and body are. So when the arousal system is too active, it can interfere or even override these other two systems, circadian rhythm and sleep drive, making it really difficult to fall asleep and stay asleep. And this state is often called hyperarousal. Hyper means overly, and arousal means active. So it's overly active. It is pretty common in conditions like PTSD, anxiety, insomnia, high stress, and also in chronic pain. So people tend to experience this hyperarousal in three different ways. First is a physical hyperarousal, meaning your body feels on edge with, like, you can notice there's a fast heart rate, tense muscle, restlessness, and also pain sensation can be also considered as physical hyperarousal. Another type of hyperarousal is conditional hyperarousal. It's when your brain becomes conditioned to stay alert instead of relax. And you will hear more about it as we go through this talk, and Dr. King will go over that much more in details. And then the third type of hyperarousal is mental or cognitive one. What that means is your mind races, filled with thoughts and worries. You may probably heard these terms like you feel tired but wired. So research suggests that pain-related worry, sometimes we call it pain catastrophizing, is actually worsen both sleep and pain. And our research team actually found that pain catastrophizing or pain-related worry decrease after treatments like cognitive behavior therapy for chronic pain or Empower Relief, which lead to improvement in sleep with people with chronic low back pain. So there is like improvement of pain-related worries can be really helpful. So let's bring everything together before I turn it over to Dr. King. So sleep is regulated by two key processes that work together: circadian rhythm and sleep drive. And the arousal system can impact these processes to make it harder to fall asleep and stay asleep. So when any of these systems are off, sleep can become fragmented, delayed, shallow, and unrefreshing. And research suggests that when poor sleep happens, it can increase pain sensitivity, make it harder to cope with the pain, increase emotional distress such as depression, anxiety, and stress level. And importantly, pain can also interfere with these systems. As you can see, the arrows are going both directions, so which can create a vicious cycle between sleep problem and pain. The good news is that there are practical evidence-based strategies that can help you to improve sleep, even when living with chronic pain. And when sleep improves, pain often improves as well. And less pain supports better sleep, and we can strengthen the cycle in a positive direction. So now Dr. Kim will actually walk through clinical and practical approach that are designed to improve sleep and pain at the same time. Dr. Kim.
Thank you so much, Dr. Kim. Good evening, everyone. I'm very excited to be here today. So we know that good sleep is the foundation for physical and mental health. And we just heard in detail how it's also involved in increasing or decreasing sensitivity to pain. So tonight I'm going to review practical tips on how to optimize the three systems that are involved in regulating sleep. We'll walk through tips for circadian rhythm. Again, that's that internal clock that lets us know when we should be awake and when we should be asleep. Sleep drive, you can think of that as our pressure to sleep, in our arousal system, when our mind and our body are alert or when our mind and body are relaxed. So circadian tip number one is knowing your sleep timing. So there's natural variability in eye color, height, IQ. So it's probably not surprising that there's also this same individual variability in sleep timing. We each have our optimal biological sleep window, and it's 50% genetic. So on the slide, you can see that there are three different sleep schedules. These are all normal sleep schedules. So some of you that are watching this evening are sleepy early in the evening and wake up early. It's probably maybe close to your bedtime. And then we have on the opposite end of the extreme, some of you that will feel sleepy very late into the evening, midnight, 1 o'clock, 2 o'clock in the morning, and also sleep very late into the morning. Again, these are all normal sleep windows. And research suggests that if you can sleep in your biological sleep window, you'll get your best quality of sleep. Problems occur when there is a misalignment of your internal circadian clock and the external environment. I would say this is more likely to occur in the delayed sleep phase, or what we call night owls, due to society's expectations that we should all be up and alert and active by 8 o'clock in the morning. If you're wondering what your sleep window or your sleep schedule is, there's a couple ways that you can find this out. So one, there's a free questionnaire online. It's called the Morningness Eveningness Questionnaire. It's the MEQ. You can take that, and that'll give you information on if you're more of a morning type or an evening type. Or you could just pay attention to how you feel next time that you're on vacation. If you don't have anything set up that you have to be at, you can notice when you naturally feel sleepy and when do you naturally wake up. But just know that sleeping in your optimal sleep window is where you're going to get your best quality of sleep. Circadian tip number 2 is to keep a consistent sleep schedule. So this is regardless of if it's a weekend or a weekday, how well you slept, if it's a holiday. Keeping to a consistent sleep schedule will improve the quality and quantity of your sleep. This consistency over time has been shown to be just as important as how much you have slept. And Dr. Kim just talked about the importance of this regularity in your sleep schedule when it comes to managing pain. Now, sleep is not a performance, so we can't make ourselves sleep just like we can't make ourselves hungry just by sitting at the table. But we can anchor our circadian rhythm to the 24-hour day by setting an alarm each day and training our brain to wake up at the same time every day. The sensitivity around this will vary, but a general rule of thumb is that if you can keep your morning wake-up time to about 30 to 60 minutes of that time, that's ideal. I like to think of sleeping past our sleep window, past that 60 minutes, as kind of putting ourselves into what it feels like when we have jet lag. We can really disrupt our circadian rhythm. Circadian tip number 3 is to build a strong morning and evening routine. So we can think of the morning routine as this wind up or wake up routine, and the evening, the opposite, where we're winding down and getting ready for sleep. There are a couple players that are involved in this process regarding wake and sleep. This would be melatonin, temperature, and cortisol. So melatonin is your sleep hormone, and it naturally increases at night with dark, and it's suppressed with light. So at night with darkness, our natural melatonin is released about 2 hours prior to our bedtime. I like to think of melatonin as the official at the Olympics. I like to watch the sprinters. The official would be the person who, shoots the gun and alerts the sprinters that the race has started. Melatonin alerts your brain and your body that sleepiness is happening. We've all heard that we should limit screens, phones, tablets, TVs, computers. And this is because light, specifically blue light, suppresses melatonin. And so if we suppress melatonin, we put the brakes on melatonin, it delays our sleep and starts to mess with our circadian rhythm. So at night, it can be really helpful to start to train your brain that you're winding down for sleep, getting ready for bed. I think parents are masters at this, as they just intuitively know that this is helpful. When you have your little one, you don't just tell them it's time to go to bed, because they usually meet us with resistance on that. We have a routine, right? Maybe we give them a bath, and then we put them in their PJs and brush their teeth, and then maybe some reading, and then we snuggle them into bed. We're training their brain that this is the routine to wind down. We are just as receptive to this routine. We're just usually not as thoughtful toward our own sleep. So as melatonin goes up, alerting our body and brain that sleepiness is happening, we're moving towards sleep, our body temperature actually needs to drop 1 to 3 degrees in order for sleep to unfold. Cortisol levels are also coming down at that moment as well. And so we can create this enjoyable wind down routine. A couple considerations: if you have chronic pain, you want to make sure that your bed is really comfortable and you've got, your blankets and pillows and things to make you comfortable. And then remind yourself that you will fall asleep easiest when you feel loved, safe, and relaxed. And then we want to do the opposite in the morning. So we want to create a routine that includes bright light. Again, bright light is going to cue the release of cortisol, which will help activate us and get us going. Cortisol is helpful here. It also puts the brakes on melatonin. Changing position, even just sitting up, will actually start that whole alert feeling that we need to have in the morning. Physical activity, social activity, mental stimulation are all helpful in moving us into that more alert state. There is one thing that I think is really important here, and that's called sleep inertia. So this was life-changing when I learned about this. Sleep inertia is this natural process that happens as our brain goes through these deep stages of sleep into being awake. And it's that groggy feeling that you have when you wake up. You swear you haven't slept enough. You just feel out of it. You want to do the sleep surfing, right? Where you're hitting the snooze button and you're going in and out of that fragmented sleep. Sleep inertia is normal. I always tell people, unless you are 8 years old, you are probably going to have this in the morning, and it will dissipate quicker if you get up, social activity, physical activity, and bright light. Now, if you're feeling sleepy during the day and you've had adequate sleep, as Dr. Kim mentioned, you might want to talk to your doctor if you're concerned that you might have sleep disorder like sleep apnea, or insomnia, or restless leg syndrome, periodic leg movement, something that would be disrupting your sleep. But just know that sleep inertia, if you can get up, get active, get moving, it should go away within 30 minutes, sometimes 2 hours. If you're a night owl, it might actually last a little bit longer. Our next system that we want to focus on is sleep drive. So you can think of sleep drive as sleep pressure. And this is actually adenosine. So adenosine is the molecular equivalent of sleep drive. And it builds up the longer you're awake and active. And so this sleep drive, I like to think of it as currency. As we're up and active, we're putting money in the bank across the day. More money at the end of the day, better sleep. So you're making deposits as you're up and active throughout the day. We also know when you have chronic pain that motion is lotion for the joints. Being active, engaged in activities that are important to you, getting sunlight during the day, which also can boost, serotonin and help with mood regulation, is really important when we have chronic pain. And the more you can be up and alert and active, the more currency you put in the bank, the more money you have in the bank, the more you can withdraw at night, which means falling and staying asleep. We know that we wake up on average, 8 to 10 times per night. If we're awake for less than 2 minutes, we won't remember it. If we have enough sleep drive, we're more likely to fall back asleep. It's also important to recognize that there are some behaviors that we can engage in that can be problematic when it comes to building sleep drive. So one is resting. So I teach a sleep and pain class at Stanford, and we do sleep logs. So we're tracking behaviors and time in bed and efficiency. We also track resting behavior during the day. If you're resting, you're not actually putting money in the bank. So you're not building your sleep drive if you're resting. And resting is a very common strategy that people with chronic pain use. So it's important to be judicious with resting, and also recognize that we might not be building sleep drive if we're lying down and resting too much during the day. We also want to think about naps and caffeine. And so people will ask me, is napping bad? And I'll say it depends. So timing and duration matter. Napping 8 to 10 hours before bedtime and 30 minutes or less with the nap. So if you nap for 30 minutes or less, you're not going into the deeper stages of sleep that Dr. Kim just mentioned, which means you're not taking money out of the bank. Caffeine is also, it depends. So timing and amount matter. So caffeine actually blocks adenosine. So you can think of caffeine as you go to the bank and the bank teller is caffeine. You've got money in your account. You want to take a withdrawal and they're like, nope, you can't. So that's because caffeine blocks adenosine. So having caffeine, before noon, couple cups of coffee. But caffeine has a 5 to 6 hour half-life. You know, it varies depending on person. But what can happen is if you have, let's say, a caffeinated beverage at 2, 3 in the afternoon, that means half of that will still be in your system by like, 7, 8, 9 at night, which means a quarter of it will still be floating around in your system, blocking sleep drive well past midnight. So you just want to be careful with the timing and the amount of caffeine. I wanted to spend a little bit of time talking about activity pacing. So this is one of the, I think, most helpful behavioral tools that we have, a chronic cognitive behavioral tool for chronic pain. And I wanted to use an example of a person who participated in my class. So the idea between pacing is that we're changing this boom and bust cycle that happens with chronic pain. People wake up, slept well, feel good, they go out, they do everything they needed to do, everything they have to do. And what can happen with that is we overdo it and we end up paying for it. And when you have chronic pain and you overdo it and you pay for it, not only do you usually just have to rest, you have to cancel plans, and you just miss out on activities that are really important to you. And what happens is that this cycle gets worse over time. So we're not able to do as much on a good day, and our flares last longer, and it takes longer to recover. So we want to change this cycle into what I call working smarter, not harder. So we're learning to do a little bit of activity and then backing off, and then doing a little bit of activity and backing off. We're not going all the way to the top. We're not doing the boom, and we're not dropping all the way to the bottom, which is the bust, where we have to just rest to manage how we feel. So this is an example. I changed the name for privacy, but Ron's example was that he would spend time doing yard work, which was very important to him, and he really enjoyed it. But he would do it until he couldn't take it anymore. So he would do it 30 minutes until it's just, his pain's just screaming in his face. And then he would have to rest, cancel plans, and just rest for 6 hours before his pain went back to baseline. So his activity of yard work was actually taking him 6 hours and 30 minutes if you factor in the flare that he was having. So activity pacing, through trial and error, he was able to figure out, okay, I can do this for about 10 minutes. And then if I take a 10-minute break, I can go back and do 10 more minutes, take a 10-minute break, go back 10 more minutes. Basically, he was able to do this, finish his yard work, which was very important to him. Took him about an hour, but he didn't have a pain flare. So this is one way that we can use activity pacing to be able to be active and productive and engaged in our lives, but not engage in this boom and bust cycle. The last system that we're going to target tonight is hyperarousal. So this is really learning how to self-regulate. Dr. Kim talked about the stress versus the peaceful response. Self-regulate is moving you into that peaceful response. So we are learning to physiologically down-regulate our system. This is very helpful for chronic pain. So these are skills that people use during the day, and it's incredibly effective for sleep onset, so starting to sleep, or if we wake up in the middle of the night, we can also use it then. If we have enough sleep drive built up, we will be able to calm our system and fall back asleep. So these are just a couple suggestions of ones that we find helpful. So there's guided meditations for pain and sleep. There's thousands of them. But progressive muscle relaxation can be really helpful. Body scan, yoga nidra, non-sleep deep rest, autogenics. I listen to sleep stories every night. It's part of my wind down routine, so I find it to be really helpful. So again, we're trying to physiologically shift into that peaceful state so that we can allow sleep to unfold, and it's helpful for managing pain as well. The next hyperarousal tip is optimizing conditioned arousal. So one thing that can happen is we can train our brain to go into this arousal state in the middle of the night. You might ask yourself, why do you wake up at the same time every night? Well, that's because if you wake up and you look at the clock, you're actually training your brain to wake up at the same time every night. They've done studies where they take healthy sleepers and they say, we want you to do one thing if you wake up in the middle of the night, look at the clock. And they develop problems related to sleep. So this is really powerful. And it's a really easy approach. Easy as in you can just turn the clock around. It's hard because your brain is like, I need to know what time it is. But I always remind people, you only need to know one thing. Is your alarm going off? It's time to get up. It's not, you don't need to worry about what time it is. And then the second piece of this is we can actually condition ourselves to be anxious about sleep if we're spending time in bed doing wakeful activities, or we're spending time in bed in the middle of the night worrying, which is often what happens. And so this is something that can be really helpful if you wake up in the middle of the night, can't sleep, you're not looking at the clock, but you can tell when you're starting to struggle, when you're starting to think you've lost. It's time to get out of bed, find a cozy corner, keep the lights low, do something that's relaxing. Maybe do a meditation, do your breathing. Think about something that's peaceful, like taking yourself on a mental walk has been proven. Don't count sheep, but take yourself on a mental walk of an area that you know well, very calming to the system. We want to have about 85% of our time when we are in bed filled with sleep. And so we wouldn't, go to the dinner table with the expectation that we're going to get hungry. We just wouldn't do that. So we don't want to lie in bed awake, trying to force sleep to unfold, because sleep is not a performance. And so no clock watching and trying to limit our time in bed, using the bed for sleep, sex. A lot of people use their bed as a reprieve from everything, but then doing these wakeful activities can train your brain to be awake in bed. And the last tip that we're going to go over this evening is challenging our thoughts. So we have two different approaches here, both equally as helpful as the other. First is a cognitive behavioral strategy called catch it, check it, change it. And the second is the art of letting go, which is more of a mindfulness approach. So it is very common in the middle of the night or when we're lying in bed, there's no distractions, so it's just us and our thoughts. Most thoughts are usually not positive. So what we would do with the catch it, check it, change it is we take the first thought, I won't be able to function tomorrow. So you wake up in the middle of the night, you don't look at the clock, you start having the thought, oh, I'm not going to be able to function tomorrow. That's catching that unhelpful thought. We would check it by saying, well, is this accurate? Do you have evidence that you won't be able to function tomorrow? Of course not. All of us have woken up in the middle of the night. All of us have had a bad night of sleep at some point, probably many. So, and you might not have had the best day, but more than likely you're able to get through it. So it's not accurate and it's definitely not helpful. So we would restructure that into something like, okay, I might not get the best night's sleep tonight, but I've done it before and I'll be fine. The mindful approach would be just noticing your thoughts and allowing them to float by. There's a great meditation called Leaves on a Stream. It's one of my favorites. You put the thought in the leaf and you just watch it float by, comes back, you put it on the leaf. So it's giving you some emotional distance from that thought without getting hijacked by it. Some other thoughts that I think are common, I just took these from my classes. I absolutely need 8 hours of sleep. We know that's not true. There's lots of variability in how much sleep that we need, and it changes over time. I need to try harder to sleep. Sleep's not a performance. The harder you try, you activate your stress system, sleep won't unfold. If I've had a good night's sleep, I should wake up refreshed. Well, we know with sleep inertia that that's not true. And then this is a pretty common one we hear with our folks that are living with chronic pain. If I spend more time resting, my body will heal. We know with chronic pain that most of the healing that's happened has happened. And now we know that resting reduces sleep currency. The less sleep currency we have built up over the day, there isn't as much to withdraw at night. And so these are just two different strategies that we can use to challenge those thoughts. And then this is just a summary of what we talked about this evening. So use light and behavior to optimize circadian sleep rhythms and also consistent schedule. Use activity and pacing to optimize your sleep drive and also to manage your pain. Engage in the relaxation response at night to help with sleep, during the day to help with pain. You want to challenge those unhelpful thoughts about sleep and pain, practice the art of letting go, and reduce excessive time in bed. And then also be careful about blue lights and caffeine. Alcohol can lead to sympathetic nervous system arousal at night. So not recommended. And then we do have let me advance. Sam, can you?
Of course. There you go.
So we have some self-help books that we think are helpful. And then we also have a list of the different classes that we offer at Stanford if you have any interest. And the website is actually on the bottom.
Thank you so much, Dr. King, sharing wonderful, helpful strategy to improve sleep and pain. So maybe I can start with Dr. King with asking you one question that actually submitted early on. One of the question is regarding actually menopause. So the question is, the menopause at 55 years brought on insomnia. How do we manage insomnia 10 years later?
Such a good question and so relevant. Thank you so much for that excellent question. So we know that sleep changes. There are hormonal impacts that affects sleep. So perimenopause and menopause are big ones. One thing that we could look at, the question is 10 years after. So some of the behaviors I think that we covered today, I'm guessing would be helpful in helping with any kind of disruption, whether it's to the circadian rhythm, sleep drive, or the arousal system. Because what started off in perimenopause could now be turned into behaviors that continue to contribute to disruption in sleep patterns. And so I would encourage the person that asked the question to try everything that we covered today, and then maybe reach out to someone specifically for cognitive behavioral therapy for insomnia, and or of course talk to your medical provider if there are things that can help with the hormonal changes that contribute to insomnia. But this insomnia is a common symptom in perimenopause.
Definitely, definitely. All right, so we have a lot of thoughtful questions submitted. So we have about a few more minutes. So I'm just going through. I don't know if Dr. King, are you able to see Q&A?
Yeah, so I'm just going to read this one. So how would you improve sleep for someone that experiences pain in their joint when there's pressure on their joints? What can a psychologist recommend outside of CBTI relaxation before bed or sleep restriction to reduce insomnia? Thank you. Dr. Kim and I were just talking about sleep positioning, I think yesterday in clinic. And so that is something that can really be helpful, is making, people are asking, like, should I sleep on my side or should I sleep on my back? And, they say if you have hip pain, sleeping on the side, making sure that you have like a pillow between your legs, or if you have neck pain, finding a pillow that, keeps the natural curvature of your cervical spine. So that would be one thing that I would recommend, in addition to maybe working with a physical therapist. I know our physical therapists are excellent in sleep positioning when there's certain positions that contribute to specific types of joint pain outside of everything that we just talked about today.
Wonderful. The next question is, are there any resources available for clinicians, especially for CBT, for insomnia, for chronic pain? So one thing that we know, there is not many, but there are some protocol or manuals that are available for CBT and kind of combined with the CBT for chronic pain. It's still under development and testing, but there are some available. And if you reach out to me after this personally, I can share some of the resources for clinician.
Another question, could you discuss the difference for chronic pain patients between resting and pacing? Oh, this is such a good question. Thank you so much for asking it. So resting in the way that I'm discussing it is like doing nothing and just kind of stopping to manage your pain. It's very common for folks that are living with high levels of pain to just cut off all activity, and they feel like the only thing they can do is rest. Activity pacing is using rest and activity in a very structured way. And so I don't even like to use the word rest with it. I would say activity, be engagement in the activity, like say 10 minutes of walking, followed by something that is either neutral or calming to the nervous system. So stretching, breathing, maybe you do need to sit down, but you're focusing on doing diaphragmatic breathing or something that is physiologically pumping the brakes on your nervous system versus just lying down and not doing any activity at all. And look, we all rest. It's not that rest is bad. It's just when I work with people and they have problems with sleep and they're resting most of the day, they really are not building up enough sleep drive. And they're getting deconditioned and they're missing out on doing things in their life that are so important to them. And so we can certainly, it's not that rest is bad. It's just we want to think about activity pacing as how to get into an activity, but work smarter, not harder. So not going to the point where you can't take it and using time, distance, and repetition to monitor that. So 10 minutes of something, doing something else, and then going back to it. Dr. Kim, do you want to add anything onto that?
No, I think you cover really well. So given our time, should we, maybe I can answer this question. James is on. So what should we do, James? I want to just check in with you.
Sure. Okay. So we could wrap up right here. That's okay with you?
Okay. Yeah. Oh, thank you so much for this opportunity. Dr. Kim and I had such a wonderful time putting together the talk, and we just so appreciate it.
Yeah, I really had a great time sharing what we know from research and backed up with a practical strategy. And thank you so much for all of thoughtful questions. And we are really sorry that we weren't able to address all of them, but please reach out to us, Stanford Pain Psychology. We can share all the resources that we have.
Great. Thank you, Dr. Kim and Dr. King, for sharing all this great information with us. And thanks to our audience for joining us for this talk and for the great questions that you submitted. If you'd like additional information or resources, please contact our Stanford Health Library. We hope you'll join us for our next lecture. Thank you and good night.
Thank you. Bye, everyone.
Bye-bye.